When you're trying to get back to running, whether it's been 6 weeks, 6 months, or 6 years after having a baby, it can be confusing. I want to compare and contrast the clinical recommendations I use with my particular patients with a 22 paper from Shefali Christopher et al. Looking at a 4-phase approach. And let's talk about first what we talk about that's similar. So first of all, we talk about symptom-based protocols. So in general, we don't want symptoms I talk about specifically more than a 1 or 2 out of 10 that don't linger. And that's going to help us determine when to progress. Not that necessarily running with symptoms is meaning that there are more problems or you're creating a problem. It's just typically people don't want to be experiencing symptoms. It can make them feel a little bit worse about their potential progress. Both of us use a walk-run structure and an interval-based progression, and we'll talk a little bit more about how those intervals are a little bit different. We both recommend a conversational pace. We want it to be something that's relatively easy to start out and make it easier to build tolerance. And then we also both talk about repetition before progression. I specifically talk about each ratio 2 to 3 times before progressing to a different variable, and the paper recommends symptom-free participation for 7 to 10 days before progression. To figure out what that looks like for you, whether you have symptoms or not, hop in my DMs. I'm happy to chat a little bit more.